Good morning. That Sunday brought to you with the kind compliments of Williams Industries Incorporated. I'm your host, Corey Lane. Our producer and technical operator is Dennis Johnson. Well, as you know, the globe is navigating these unprecedented times, and the Barbados government and their team has asked for the people's support, participation, and cooperation as we successfully navigate through the national COVID-19 response. And to successfully overcome these challenging times, there have been change. And one thing constant in life is change, but many of you know that most humans resist change. With the recent changes in our lives, many of you have unanswered questions. Well, here on Brass Tacks Sunday, I believe we have the answers. To help us to get through the many questions that you have, we have on air and with us for this show today, the COVID-19 National Response Team, led by Attorney General, the Honorable Dale Marshall. We have the COVID Czar, Mr. Richard Carter, and from the Ministry of Health, Chief Medical Officer's Office, Dr. Anton Bess. I'd like to say good morning and welcome to you, gentlemen.
Good morning.
Good morning, good morning, good morning.
Okay, we are going to get down to brass tacks, but just some housekeeping before we go, some house rules. Now, I don't intend to be sharp, as we would say in Barbados, unmannerly, unkind, or rude. But I just want to state this is a very important topic. Many people have questions. So I'm inviting you to call the program at 434-1790 or send your short WhatsApp to 266 IVOB, that is 266-4862. And the whole purpose of today's program is to get a lot of clarity out there. So I just want you to come, ask your question. If you feel the need for a follow-up question, let me moderate that. And I ask the guests equally, if you, in your response, if you can be as succinct as possible, please do so. But if you do feel the need to expand on a reply, go right ahead. So with no further ado, we're going to give credit to the sponsor, and then we are getting straight down to Brass Tacks. This is Brass Tacks Sunday with the kind compliments of Williams Industries Incorporated. And the lines are going, and I would assist you by letting you know that in terms of the lockdown measures and so on, I believe a lot of those questions could be directed to the Attorney General. In terms of specific programs the government would have put in place, they have put in place, you have Czar Richard Carter, and in terms of the actual virus itself and the Ministry of Health response, I believe you could direct those to Dr. Anton Bess. Of course, any of you gentlemen with any information or any of the questions can feel free to jump in and bring clarity to any of the issues raised. Let's go straight to the phone line 5 minutes after 11 o'clock and say good morning and welcome to our first caller. You're on the air.
Good morning, sir, to the panel. Good morning to the esteemed panel. Just a simple question. Can I go to the beach? I have been getting missed signals. One police officer told me I can't. 2 hours after, another police officer I met told me I can. What is the real thing? Can I go to the beach? And how many people could I carry? Can I carry 2, 3, 4? Could you please answer that and let me know? Clarify it for me, please.
Thank you, sir. Have a good morning. Can we go to the beach?
If I can jump right in on that. Let me just say that the government of Barbados during this period is not keeping the people of Barbados under siege. Our overriding mission is to help to reduce the spread of COVID. But as far as we're concerned, Barbadians can do certain things as long as they're responsible, and going to the beach is one of them. While we are saying to Barbadians that they need to stay at home, we still have to operate within a cultural context. Today is Sunday. Barbadians will traditionally go to the beach on Sunday. In fact, depending on who you listen to, seawater is very good for helping with respiratory illnesses. So yes, sir, you can go to the beach, but we are insisting at all times that you be responsible, maintain physical distancing, and do not congregate. So if there's a family who's thinking today's Sunday, let's have a beach picnic, not on. But on the other hand, if you want to go to the beach and enjoy a little Sunday recreation, we're not going to stand in the way of that.
Thank you very much, sir. Let's keep it going. Brastat Sunday, good morning.
Hello, good morning to you, panel, esteemed panel. Mr. Lane and panel.
Hi, good morning.
Last night was the best night I ever encountered in my 64 years.
Oh, goodness. I wonder why that is.
Listen, the noise, the motorcycles running about, keeping a big man, the noise, people cursing, and listen, I would like it so till I die. I would like this country so till I die.
One man's inconvenience is another man's enjoyment. Thank you, sir. Brastat Sunday, good morning. You're on the air.
Hi, good morning. Am I on the air?
Yes, you are.
Oh, good morning. This is to Mr. Marshall. Now, Mr.
Yes,
Marshall, sir, I remembered years ago we had an outbreak of conjunctivitis in this country, and everyone ran to the sea because they were told that seawater was good for the conjunctivitis, and it made it worse. It was island-wide. Again, you are telling the people that they can go to the beach because seawater is very good for some respiratory illnesses.
No, ma'am, please, let me stop you. I have not said that seawater is good. I am not a doctor. I have absolutely no medical training. I said that some people say.
Yeah, but sir, that is irresponsible mouthing because you know Barbadians. We will all go to the sea when we start to cough.
But let's bring in Chief Medical Officer here, Dr. Anton Best. This whole idea, because a lot of people coming up with a lot of home remedies as well, and then speak to that in the program. Seawater and COVID.
Yeah, thanks a lot, Corey. So the caller is asking a very good question. So just to add to what the AG said a few moments ago, we are not advising people to go out of their homes when they're ill. So the advice to go to the beach and advice to do certain activities with the restrictions that are put in place do not include if you're ill. If you are ill, particularly if you have a respiratory problem, you have to seek medical attention. And the way that you do that is to call your regular healthcare provider to get advice. You can call a polyclinic when the polyclinics are open. You can call the hotline that has been set up to get advice as to what to do. So the advice about going to the beach when you had conjunctivitis, to be honest with you, I hadn't heard about that, but that's not very good advice. No one who is ill should be, especially with respiratory complaints, should be leaving their home and going to the beach.
Very good. Now, that's the other thing I want to add before we take the other call. I want people to, we can do our best to put on these programs. I want to thank you three gentlemen for taking time out to come and answer questions, but I need the public to meet us halfway, and that is to listen well and hear what people say and not what you think people say. Like, for instance, the AG never said anything about it helping. He said, people have said that, and I'm sure that it helps in other ways, as a lot of people have a lot of anxiety and stress and so on, and the beach is a kind of place that can assist with that. Therapeutic. So I want people to meet us halfway. This is too important to play with this. So let's just keep it going again. 10 minutes after 11, Brastat Sunday, you're on the air. Good morning and welcome.
Good morning to you, sir.
Hi, good morning.
Yes, sir. To the panel also. This is to whom it may concern. Now, my main point this morning, 2 points I have to make. The young people tend to feel that they are not accessible to this virus. They have to get a strong message telling them that they are also included to get it because they don't feel so. Next point is that there are some vagrants or homeless persons sleeping in the Bay Street Esplanade and in the other shack. That should be continued because people goes in there to have certain little discussions and so on, especially in the Esplanade. And that those persons that sleeps in there at night at this time should not be allowed to. Thank you, sir.
Okay.
If I can make a brief response,
Sure.
So this is Richard Carter. First of all, the issue about young people. We have made it clear in all of our communication that even though young persons may get a milder form of COVID or may be better able to deal with it if they get the illness, that they are by no means immune. They are also by no means at zero risk of getting gravely ill. And if we were to look at we are reasonably early on in our epidemic, but if we were to look at the data coming out of countries that have had large numbers of cases, there are people who are dying as early as below 10, right through to nonagenarians, people over 90 years old. So people can die. The second thing is that what we've said to young people, and this message has been repeated several times, that you have a responsibility not just to protect yourself, but to protect your parents, to protect your grandparents, to protect those persons who may live in the household with you. And that message has gone out several times. I don't think that, obviously we are doing and using a variety of means to try to reach people, but the message is clear. You are not immune, and further than that, you are placing other people at risk. In respect of the question or the concern about persons sleeping in the Bay Street Esplanade, I am pleased to say that the National COVID-19 Preparedness Plan has reached out to the Barbados Alliance to End Homelessness, and we have specifically engaged them in respect of trying to ensure that the number of persons who are sleeping on the streets are offered and that they have available the appropriate facility for them to sleep at night. I am extremely impressed with the proactive measures that have been taken by Kemar Safri and his team. We have also made representation to the Attorney General for that shelter to be exempted, because we want to ensure, or persons who work in the shelter to be exempted, because we want to ensure that as many people as possible stay off the streets and are able to be accommodated.
Okay, thank you very much. I'm going to take a healthy mix of calls and messages. I am taking on my Facebook, I've gone live so that people can interact there as well. But of course, we have the WhatsApp. The first question here I see is one. It says, Corey, I have a question. A JetBlue flight came in the country yesterday around 4 p.m. and visitors were seen disembarking the plane. Why are we allowing visitors in at this time?
Okay, let me say that the protocol in relation to flight, we have made it quite clear that anybody coming in from from the United States, from Europe, if they come to Barbados, they are under quarantine. But that's not really your question, but I'm just making that point clear. We are making sure that Barbadians are not put at risk. Now, as far as I am aware, flights for pretty much all of the airlines are now at a standstill, and therefore that issue will not continue to arise as we go forward. In relation to the flight that came in yesterday, I am not aware of the specifics, but I am aware that on occasions, JetBlue has actually canceled flights in cooperation with the government of Barbados. So I will say that I will have to look into the issue of the JetBlue flight that came in yesterday. I don't know how many passengers would have been on it. I am aware that some flights have come in with as few as, I think a BA flight came in and had a crew and 12 people, and every single person was immediately sent to quarantine at Paragon. So we are making quite sure that anyone who is exposed has to be quarantined and not exposing Barbadians to the risk.
Okay, roger that. Thank you. Take another call. Brastat Sunday. Good morning.
Hi. Good morning.
Hi. Good morning.
Hi. Good morning. I just want to say morning to the panel. I want to reach out and say I wish the Prime Minister best of health, and I believe that she, as well as the government, has done a wonderful job so far.
Thank you very much.
Dealing with all the stages incrementally. I want to say big thank you to the Czar and all the members of this fighting. My question is such where I was a little disappointed that the dental surgeons or the dental fraternity was not listed specifically in the list of exempt persons. I mean, I know that we can because I've spoken to, I've called the hotline, but I believe that we are right up in there dealing with the patients. Now, we have people, I have persons yesterday finished work, say around 12 o'clock, and between 12 and this morning I got about 5 calls with people in pain. And obviously we will have to deal with people with certain emergencies. And I don't think it would have taken much for the AG to have just made sure that we as professionals would have been included right there for people to see. So just a bit of disappointment. I know that it's a fluid situation and you wouldn't remember everything. But at the same time, because of the nature of our job and where we are within the fight, I believe that it should not have been forgotten. But
all right, caller, stick a pin again, get a response, and I'll let you ask a follow-up question if required. Who wants to take that one?
Yeah, if I can say, well, maybe I should let Dr. Best speak from the point of view of medicine. But let me say that, and this is not a case of us asking for any special favors. We are here to govern. This has been a new experience for Barbados. As I keep saying to people, I don't know of anyone in living memory who has a recollection of any state of emergency ever having been called in Barbados, and certainly not as it relates to public health. In fact, you would know that we had to go to Parliament so as to put special arrangements in place for public health. We felt that the definition of medical persons, paramedical professionals, nurses, and so on, staff of hospital clinics and pharmacies would have included dentists and allied services, and I'm happy that you consider that it's able to do that. But I can assure that if there is any situation that requires clarification, we are more than happy to do so, and we've been doing so at every step of the way. I apologize that we didn't specify dentists, but certainly when we talked about medical professionals and so on, there was no doubt in my mind that dental facilities would have been open. Anton?
Yeah, absolutely, AG. That was also an oversight on my part when I would have seen the draft list, because it did talk about the public sector services in terms of health, and of which there are dental services that we provide in the Ministry of Health. And then it talked about our counterparts in the private healthcare sector, and it was all encompassing. So dentists are included, even though they weren't explicitly highlighted or stated.
No. But I reiterate that if there's any clarification on any part of the directive that is required, we shall certainly be willing to do so.
Yeah, and I only brought it up specifically because this morning I got up and I called the hotline and I asked about the beach. And at that time, the person answering, I said no, and then an hour later we were told that's not true. So only from that perspective, because as I said again, it's a fluid situation, everybody will not be able to know everything at this time. So I just wanted to make sure that certain things were highlighted by, how can we say, by significance, that some of us were not forgotten, so that it didn't become a situation where we had to ask a question to the hotline, were given a yes one way and then a no another, only from that perspective. But thank you to everybody.
I appreciate that. Thank you very much.
Good luck going forward.
All right. Thank you, gentlemen. Lots of questions here on employment, and because there are like a gazillion WhatsApps in already, I'm going to combine. So if you hear a question answered in a different way, don't fear. Cannot ask all. As Loretta say, can all. Good morning. Can someone please explain if it is right for employers to give staff holiday and also close the business at the same time? Thank you.
Well, let me say that under the order, businesses have to be closed. So if you're closed, you're closed. But at the same time, I think we have to operate in a give and take situation. As Attorney General, I will be the first person to say that the Holidays with Pay Act stipulates that you cannot compel a person to take holiday unless you give them 14 days notice. So anybody who compels an employee to take holiday because their business is closed, they could not have given them the 14 days notice because the Prime Minister only announced the curfew on Thursday. So it is a breach of the law. But at the same time, we recognize that this is a difficult time economically for companies, difficult time for all of us. We really don't know when this COVID thing is going to pass so that we can return to a state of normalcy. So as an administrator, as a member of the government, we are always hoping that both the employer and the employee can resolve these issues in a way that's reasonable and constructive. An employee is able to say, no, I'm not taking my holiday. So you have to still allow me to take my holiday later in the year. That's a position that we want people to resolve amicably. But the law is the law. You cannot compel an employee to take holidays. So even if the business is closed, it is wrong for an employer to force the employee to treat that time as holiday time. But I am aware that in many instances, businesses and employees are coming up with reasonable compromises.
Okay, roger that. Brasta Sunday, good morning.
Hello.
Hi, good morning. Welcome.
Peace be unto you and yours, and to the minister.
Thank you, ma'am.
My concern, before I start, I too want to send heartfelt get well greetings to our Honorable Prime Minister, Ms. Martin, my family and I wish her all the best. And as I said before, I know she need rest, because since she's been there, she have done a lot of work, and every time I look at her, I always saying she needs rest, so she need that rest. So I wish her God.
She's getting enforced rest now.
Pardon me?
She get it.
She's now getting enforced rest.
Yes, well, sir, my concern this morning is when I got up and I look at my WhatsApp, I was very, very touched. I mean, we are saying who don't have the many choices of viewing, they hear on the radio, people sending WhatsApp messages, and we see out in Italy and France and those other places how many lives are lost. And in this small people are at risk to protect the vulnerable. I wish Barbados all the best, the Caribbean, and I pray that God will soon send some scientists with a cure to cure this. We've lost 2 of our citizens, our Barbadians in America, and it's really heart-wrenching. And I on behalf of my family, and I want to pass on deepest condolences to those Bajans who are in America that have lost their lives. Thank you very much. It's a pleasure speaking to you, Attorney General.
Okay,
thank you very much. Thank you very much, ma'am, for your kind words and for your best wishes for the Prime Minister. I received a report about the incident, Saturday morning, in the wee hours of Saturday morning, from the police, and it really makes it clear to us that there's an element of our society that could care less about what the country is going through as long as they get what they want. I'm very happy that in the location that there were video cameras, the people were wearing masks, but the police are still able to get certain evidence from whatever they have. In relation to your concern about the safety of Barbadians as they go about their business, we have spent a lot of time in the police force developing a plan to deal with this situation, the situation of COVID. Obviously, police are just like every other individual. Police can and do get sick. Nurses will get sick. Everybody has a chance of getting this disease. So our first concern has been, in the event that the Royal Barbados Police Force is hard hit in terms of people having to be quarantined or people falling ill, how are we going to make sure that Barbadians are safe? And I think that we have a very good plan, which will see a better utilization of our resources. We are looking at the prospect of actually bringing back up some retired police officers to help to shore up any short areas. But at all times, we're trying to make sure that Barbadians are safe. It is a good thing that too many people are not on the road during the curfew period at night, because that gives the police certain advantages. Those individuals who have to be on the road, we're putting a system of passes in place so that they can have a pass that they can show on their mobile phone to the police, who will have the ability to read that data online. So that if a person is on the road and up to no good, the police will have a very, very easy opportunity to arrest what they're doing.
All right, thank you very much. Good response. And I think we're going good. Let's take another call. Brass Tacks Sunday, good morning.
Good morning, Corey.
Mm-hmm. Yes, please.
And good morning to your panel. Hello?
Good morning, man.
Good morning, good morning.
Very upbeat.
Oh, okay. First, I'm sending get well wishes to the Prime Minister.
Mm-hmm.
My questions,
Thank
my
you so
three
much,
questions. Are employees getting paid for the 2 weeks off from NIS? That's number one. Number two, what becomes of the Chief Medical Officer? Number three, are all borders still open to private plane travelers going on the West Coast? And are they being tested for the corona? That's my three questions.
What was the second question?
Let's do it one by one, man. Let's go. First question.
Are employees being paid by NIS? The NIS has a system of paying employees in certain circumstances. However, if a business is closed in this situation, it is not a layoff situation, and therefore the NIS doesn't kick in. It is not a sick leave situation, and therefore the NIS doesn't kick in. So when we say that people have to share the burden, the fact is that employers really are going to be under an obligation to pay their staff at this time.
Okay. The other question she had was, if anyone else on the line could remember, she had asked
the question
about
sounded like what became of the CMO, but I'm not understanding what the caller meant.
We know we've had acting CMO Kenneth George. We've had I think she means the other CMOs.
Okay,
put it like that.
So essentially, the substantive acting chief medical officer is on leave at this time.
All right.
If I may, the third question was about the private travelers, the persons who come on private jet.
Mm-hmm.
Right. So the policy, as I understand it, and AG, please correct me if I'm wrong, but we did make special provisions for persons who reside in Barbados to go into self-quarantine for a period of 14 days if they're coming from any of the countries of interest. And those countries were listed earlier: the U.S., the UK, Europe, in addition to 4 countries that had long been on the list. And that decision was made just about 2 weeks ago. So we have had situations in which persons clearing customs and immigration did say that they were going to their villa. They did pass through Port Health, and they're under a period of quarantine, just like persons who reside in Barbados going into quarantine in their homes.
Okay.
And Corey, just let me stress that the persons are not simply going to their villas or going to private residences, but they are, in the period while they're in quarantine, they are followed up by our health officials to check and ensure that they are not reporting any symptoms and that they are in fact well.
All right, so what I think we should do to give that a comprehensive answer and not patch, let's go through the procedure as set up by the Ministry of Health, Port Health, and everything from the time someone arrives here to the time they get into quarantine and what the quarantine is supposed to look like?
Sure. So from the 26th of January, Corey, when we were keenly aware that there was a major epidemic happening in Asia where COVID-19 is concerned, we started surveillance at our ports of entry because we were expecting imported cases. So to reduce the likelihood of an imported case, we started screening by asking travelers where they traveled from. So initially on that list were travelers from China, and we broke it down. If you were from Hubei province in China, you were considered to be at extremely high risk and would have had to go into mandatory quarantine. Or if you were from other parts of China, seeing that there were other pockets of the epidemic happening outside of Wuhan, you would have gone into a 14-day quarantine period. For the 14-day quarantine period in your home, there's a team, a public health team, that would monitor you on a daily basis. I should have added that you would have been given instructions as to what the quarantine looked like. So you couldn't interact with people outside of the use of a telephone or from a distance. If you needed food or water brought to your home, somebody would have to do it and leave it there, but you could not come in close proximity to those persons in quarantine. The public health team would call on a daily basis, and they would also go to the person's homes to ensure that they were complying with the directives of Port Health, and then to also monitor the person. So they would take a temperature, and then they would ask if you developed symptoms over the last 24 hours since the team was last there. So initially we had China, and then we added the Republic of Korea. We then added Italy and Iran. And then more recently, the US, the UK, and Europe, as I just mentioned. We got to a point where the visiting on a daily basis was no longer feasible because it is quite labor intensive. So the same instructions were given, and the same team that would do the home visits would then call the homes, preferably on a landline for obvious reasons, to make sure that persons who were supposed to be in quarantine were adhering to quarantine and that they were well. On occasion, you would have somebody in quarantine that would develop symptoms that were possibly suggestive of COVID-19. We would then arrange for that person to be tested and for the test to determine what next. If they did develop COVID-19, they would have been sent into the isolation center. And let me just add that none of those persons that we had in quarantine, if I remember correctly, ended up actually becoming positive for COVID.
Right. I think that part is very important because lots of people, we've been telling people to follow the credible sources. Lots of people give the impression that lots of people come through the airport and just walk right through. I had a debate like that just about a week ago on Brass Tacks, and many people just try to make it seem as though this is what has been happening, although it was made to understand by the officials that this is contrary to reality. So I just want people to continue to follow credible sources. Dennis?
Thank you, Corey. Morning, panel. Following on what you say, so on Friday, as the producer of this program, there was a call to Mr. Ellis, and the person claimed that they were standing outside of a commercial bank waiting to get in, and there was someone there who claimed that they were supposed to be on quarantine, but they had to get into the bank, that they were not going to use the ATM, but they had to get into the bank. The person claimed they called an official at the bank, they called security to deal with it, and the person insisted that they were staying there to get into the bank, and they claimed out loud for people to hear that they were on quarantine. The question that I'm putting at the end of this is public mischief at this time, and perhaps this is at the AG, because I don't know whether this actually happened, whether people are actually making these claims in public, but is there a way that the public, faced with this type of reaction, what should they do? Should they call the police? Should they call an official? What should they do if this happens?
Are you hearing me?
Yes, please. Go
Clearly,
ahead.
sir.
Yes. Yeah. Well, I think public mischief is probably as bad as intentional criminal activity. It puts people into a state of despair and panic, and it is one of the problems that we've been dogged with from the time we started dealing with this virus situation. People putting up fake news of shutdowns and so on. Any person who claims that he should be in quarantine, the police should be called, and the chief medical officer would be involved. We say that the chief medical officer is the most powerful man in Barbados. He can put anyone into isolation. He can shut down any enterprise. It's a bit awkward, but the right thing to do would have been to call the police, and the police would then be able to intervene. There's an individual who's supposed to be in quarantine but is not, and the chief medical officer can immediately put that person into isolation.
All right, we're going to take a break. When we come back, we may want to spend a little time on this whole idea of public mischief as a crime, and also look at, with some moral suasion, we may be able to convince the majority, but I think we need to outline to the rest who would always want to be part of that. What are some of the measures that can be used by the state apparatus to bring that to an end? This is Brass Start Sunday with the kind compliments of Williams Industries Incorporated. This is Brass Start Sunday with the kind compliments of Williams Industries Incorporated.
Get all your lumber needs, come on. We have number one fixed line, all different types of plywood, big joint, sided, and concrete board. In addition, we have 3x4 and 4-ply epoxy.
Visit their website at www.williamsmetals.com.
The Chief Medical Officer and the COVID Czar, Attorney General Dale Marshall, COVID Czar Richard Carter, and Chief Medical Officer Anton Bess. Now, it's a little overwhelming here. I tell you, a lot of calls coming in, lots of messages and so on, more than usual. But I think that we're doing pretty good, and I would encourage you to continue to keep your questions and answers quite to the point. Down to Brass Stats, good morning.
Good morning, how are you?
I'm fine, thanks. And you?
Yeah, fine. And the panel as well. Let me start by saying that I wish the Prime Minister a speedy recovery, and I wish her all the best. And focus on yourself, this Prime Minister. Barbados, take care. Now, let me start by complimenting the government and the stakeholders and the whole team for the act for the COVID-19. To my mind, just looking at it from our position, I think Barbados handled it excellently well. Now, they are following the WHO idea. Testing, contact tracing, social distancing, and quarantining. Now, most of the countries that I look overseas, the big international companies get overwhelmed in their hospitals. Glad to say Barbados is well and truly organized. Now, a couple of little questions that I'd like to ask here. Now, I don't know if you want me to do one.
Do one by one, and let's do it quickly.
Good.
Sure, fire.
When the next update is coming?
All right, next update.
Mm-hmm.
Anton? Sure. So, at present, we have, as of yesterday, we have 33 cases of COVID-19 in Barbados. At this current point in time, 16 of those are males and 17 of those are females. The majority of cases that we have are imported. 19 cases of those 33 are imported. 11 have been identified through contact tracing, and we're still investigating 2 of those cases. And that's out of a total of 287 lab tests that we've conducted over the last 3 to 4 weeks.
Roger that. I think you made an update as in the national update?
He answered the question.
Okay, good.
Actually. Mm-hmm. Right, the next one is, we're talking about bringing Cuban doctors and nurses. They're going into quarantine? For their quarantine? Cuban doctors and nurses?
I'm not a doctor, but I raised that question with the Minister of Health. And Anton, you can tell me if this is correct, but my understanding from the Minister of Health is that the people the Cuban doctors who are going to be coming in are going to be working in the isolation centers with COVID patients.
Correct.
Okay.
With patients who have been tested positive for COVID, and therefore it is not. If you have it, then you can give it to a person who already has it. But I do believe that the Ministry of Health will determine its protocols. That may not be quite complete because obviously the nurses are going to be living in our communities and so on, renting houses and things of the sort. So I believe that the imperative would be to quarantine them.
Right. AJ, if I might add, the Ministry of Health is working with the Ministry of Foreign Affairs on this one. And the question was raised, to what extent do we need to be cautious of persons coming from Cuba where COVID-19 is concerned? At last count, I believe it was on Friday, there were less than 90 cases of COVID-19 in Cuba. And if you remember the population of Cuba being substantially higher than Barbados, we do not see Cubans coming to Barbados as a risk. Be that as it may, we are still going to be putting measures in place to screen persons who are coming in. That would entail taking a history and asking if they have any signs and symptoms in keeping with COVID. So rest assured that we're not looking to make a bad situation worse by bringing persons who themselves are infected. And then, of course, we pay very close attention to what we do in hospital settings and in clinical care settings in terms of infection prevention and control, because we do not want any healthcare workers to be exposed or to be themselves positive for COVID-19 where they can infect persons.
And the last question is probably a two-phase question to the Attorney General. Well, are you all considering a ban on these? Well, all the stations in Barbados have what we call the stations that broadcast to the young people. If we could put a hold on them. And the second part of that question is, if we don't have saying that the children are on vacation, vacation, yes, fourth one. If we can use these said stations to broadcast and educational content to our young people, it should be more beneficial to what they spout out on a daily basis. That's my third.
Well, let me say, sir, that Barbados is not. The Barbados government has never been in the business of censoring station content. Our only limitation on that is that every station in Barbados has to carry a small percentage of government programs. Media and broadcasting services are exempt by virtue of being essential services. I think Richard Carter, would be the first person who would agree that in order to be able to fight COVID, we need to have all of our media on board. Information. And therefore, while I understand your sentiment about the stations that our young people listen to, I don't think that would be a good idea. I think we have to get those stations involved in the fight. I believe that they are, especially since your caller earlier pointed out that some of the young people are very cavalier and carefree about this disease. So we have to use the media that they listen to in order to reach them. So there's no plan at all to cut back on, to stop any radio station from playing. We can't ban them. That's not how we do things. But what's more important is that we use all opportunities to reach all target audiences, and the young people audience is a very, very important audience to reach at this point. I don't know if Richard would want to add anything to that.
Yeah, I want to make a quick addition to what you said, AJ, because I think we really need to compliment the mass media in Barbados, which has, generally speaking, been extremely supportive of the response in terms of their outreach. I have heard myself numerous public service announcements. I've heard the urgings by the DJs and the other persons who work at the station consistent with the messaging that the government of Barbados has been putting out. And we are satisfied that the stations themselves have been acting responsibly in this matter and are critical, obviously, to the outreach and support. Just a brief addition, the caller mentioned the use of radio stations for broadcast in the event that children are not able to go back to school. I am aware that the Ministry of Education is really advanced in its planning in respect of its outreach to children and the use of the technology to reach particularly those children who will be doing the Common Entrance examination, as well as students who are preparing for CXC. And I know that discussions are ongoing all the time with the Ministry of Education in respect of that. We are actually in a really, really fortunate position. My experience from Sierra Leone was that the radio stations had to be employed in respect of outreach to students because there simply was no other means available. We do have a range of technologies that are at the disposal of the Ministry of Education, and I know that they are going to be pressed into service if the shutdown and the requirement of schools to be closed persists beyond the current anticipated period.
All right, excellent responses. I try to get quick fire responses to a number of questions that are showing up here over and over on the different platforms that we're using. But I had 2 airline officials just confirm to me that the flight that came in from JetBlue was actually ferried here from JFK to take some Americans home. I can't say I can confirm that, but I do know the 2 airline officials that are reaching out to me at this time.
Yeah, Corey, that is correct.
Okay, good, brilliant. See, good, we're working. Down to brass stats Sunday. Now, AG or any 3 of you actually can answer this in quick fire manner. These are people asking about specific cases. Newspapers are essential. Can we go out and get them? Yes or no? Can we go for a walk alone on the street for exercising or whatever?
If you can go to the beach, you can go for a walk.
Correct. What about people selling kites? Can I continue? Can I sell kites on the road?
No, please do not sell kites.
Because they gotta go and fly them. Anyhow, the bodywork men are asking. I can do bodywork. Go ahead.
No. The bodywork men are asking.
The bodywork men are asking if they could. They have a couple of jobs that they can do at home without coming into contact with anyone. Can they continue to do that work?
Yes, that's a person who is self-employed doing the business at home. We're not going to tell a bodywork man who has a car parked alongside his house that he can't go and work on it. Remember at all times, and Anton, please, if you can help me with this, at all times our mission is to reduce human-to-human spread. We're telling people to stay at home, okay? But while we're closing businesses, and we're saying to them, we have to close your physical presence in the marketplace so that your employees will stay home and your customers will stay home. But clearly, a mechanic shop, we're all based and we know what we're talking about. A mechanic who is working on a car at his house is being a most responsible person. I would hope that the mechanic does not continue to take in work while we are in curfew, but we certainly would not be looking to go to anybody's workshop at the house to tell them, to stop fixing a car.
Again, Barbadians are very literal people. I remember listening to you in Parliament. You say construction done even if you're building a step, but I didn't take it literal.
Yes.
I think if I build in a little step home in my backyard, I finish in it.
No, but you see, but we have to differentiate. What we're doing is closing businesses. We're not stopping people from doing their own thing. Okay? If a man who is building his own yard wall is not engaged in a business.
Correct.
All right?
Yep.
An electrician who is fixing somebody's air conditioning unit in the workshop, we're not going to be policing that. On the other hand, if that repairman is bringing to work his staff, that's a no-no.
Correct. Okay, good.
I think a lot of the answers to these questions, when we think them through and start out from the premise that we're minimizing human-to-human contact, we will have no problem. And let me say, I know we got to move on, but let me say that the government is encouraging all those businesses that have been closed, where their physical presence is closed, to let their employees work from home. We're closing your physical space, but we are not shutting down your operation if you can do it remotely.
Good. So, Corey, if I may come in, just to add to what the AG is saying, what we're currently doing in Barbados is unprecedented because we have a contagion that requires spread from a human to a human. If we were to take the entire population of Barbados and to have them absolutely stand still and not in contact, well, not standing still, but not in contact with another human being, and that means not within a 3 to 6 foot radius, the contagion has no way of continuing to spread. Those persons who are sick will eventually get better when their immune system eventually fights off the bug successfully, and you will not get the continued spread. You would have essentially contained and stopped the spread of COVID-19 in Barbados. But realistically speaking, that can't happen. So not all persons in Barbados can absolutely stop interacting with other humans there, and that's why you have the essential services. So once somebody's doing something at home and they're alone and they continue to practice social distancing or physical distancing rather, that person is not only in keeping with the law, but from a public health standpoint, they're keeping themselves safe and persons around them safe, just in the event that they themselves were positive for COVID and asymptomatic at that time.
I think the answers that you all just gave were really of serious importance because so many questions came in during that, and then persons are now messaging saying, okay, I think you've answered the question, because there are a lot of individual specifics. But I think if you think generally across the board, if you're doing a home project, you are not engaging in contact with the public, then it is okay. Otherwise, it is not. There are some anomalies then I would try to draw instead of the specifics. And I believe from the response that you gave, I'll try to answer some questions to see if we're on the right track. So I want to answer if I can open my pawn shop. I believe that is a no. But then they're asking here about the hardware store, because they're saying, you get burst pipes, clogged toilets, and so on. What about hardware stores?
And hardware stores are also a no. And we understand, I mean, somebody said we should keep hardware stores open because they also sell alcohol, and disinfectant. But we are opening those businesses, we're allowing those businesses to open that cater to certain categories. Provision of health care is one, and I think that makes perfect sense. Nobody would have any difficulty with that. So pharmaceutical manufacturers, pharmacies, they can open. People who produce food, because Barbadians have to be nourished and eat during this time. So we're allowing any enterprise that produces food to open. Okay?
What would you advise people that are concerned about the burst pipes, especially with the drought we go through and so on? How should they address that?
Well, I'm afraid, listen, this is a difficult thing. Everybody's going to have to suffer. If my car tire bursts tomorrow or bursts today, I have no way of fixing it because the car tire people are closed. Okay? Now, as Attorney General, I am dealing with exemptions. And some individuals in the motor vehicle industry have written to us for exemptions because they do work for the fire service, because they provide things to the ambulance service. Those are essential services. And I suppose somebody would think that if I provide something to the ambulance service to keep them going, we should be exempt. But you know what? We are prepared to give exemptions if something urgent arises so that you can fix that need. But I can't allow a motor vehicle business to open just because among the million things they do, they also provide parts for ambulances.
And the other thing is, let's get real. If you do too many exemptions, it defeats the purpose to start. You have too many people out.
I've got probably about 200 requests for exemptions in the last 24 hours.
Only?
No, the last 24 hours.
Yeah, well,
it's been over 40 hours since the PM made the announcement. Everybody wants to find a reason to be open. We just can't have that. And we are saying that if there's a situation at the hospital, if there's a situation in the ambulance service, if there's a situation that will affect how the police function and respond, we will give exemptions limited to those things alone. We'll give
Corey, a
exemptions
quick comment from me, if you don't mind.
Yes, go ahead, Mr. Carter.
And I want to quote something because a lot of people are concerned about the economic fallout, and the government is sensitive to that. I think the government has demonstrated that there is a measure of sensitivity and respect of the consequences of some of these things for persons, for ordinary persons. But I want to quote something from President Akufo-Addo, the president of Ghana. We know how to bring the economy back to life. What we do not know is how to bring people back to life.
Hear, hear. Hear, hear.
That's it.
Powerful statement. Powerful statement. Let's go back to the lines and then we'll try to plow through the Attorney General, over 200 exemption applications here alone. Brasat Sunday, good morning. You're on the air.
Good morning. This is David Ellis speaking. I have two questions here. One relates to the numbers that have been given on the 33 positives. Now, some time ago, Mr. Carter, you said to us on Brasat that you would have triggered the stage 3 if we found one tertiary level case, and you defined what that meant. So one question is, of those who have tested positive, how many fall into this tertiary level stage? And when we look at the numbers, what do they tell us about the rate of spread in Barbados and where this trend is likely to take us? So you can take that. And then there is a question from someone who operates a bakery that provides bread for the essential services, and their production is done early in the morning. They want to know what provision can be made for drivers that collect for the bakeries at around 4 in the morning, and they have to transport the people to work. They want to know, is there a sticker or something that can be used to facilitate those persons? So those are the two questions that I have, or two sets of questions that I have here.
If I can just give a quick response, I know the Chief Medical Officer will have the specifics in terms of the nature of the cases themselves. But in some respects, this is almost academic because stage 3 has been triggered, and in fact was triggered even before we reached the other definition that we had imposed on this, which is 25 cases in terms of the numbers. And we have been consistently aggressive in our response and triggering stage 3 even before we had reached the definition of stage 3 in terms of the number of cases was done because we have seen very clear evidence of what has happened to those countries that waited. We've seen clear evidence of countries with healthcare systems much more extensive than ours to the point of being overwhelmed. We've seen an explosion of cases in many places where the number of cases have doubled and tripled over the course of 24 or 48 hours. So, in a sense, we triggered stage 3 even before we got to the point where we had reached 25 cases because we wanted to keep ahead of the epidemic.
If I may add, Mr. Ellis, the stage 3 was also defined as community spread. And when I gave the total number of cases that we've identified in Barbados, I would have mentioned that out of the 33, 19 cases were imported. And these are usually persons who reside in Barbados who traveled overseas and came back and became symptomatic, and we therefore had reason to test them for COVID, and they were positive. 11 cases are through contact tracing, so persons who came into close contact with those index cases. We have 2 cases that are still being investigated. What we don't have is evidence of community spread at this point. So when you made reference to the tertiary level spread that Mr. Carter had previously mentioned, that's what we're talking about. Community spread, we do not have any numbers or any indication that it is happening. We believe it's happening, or it could be happening, and that's why we're looking for it. So we encourage people... Sorry, go ahead.
No. I mean, you go ahead and finish, Anton. I'll speak after you.
Right. So from a surveillance standpoint, we are constantly reviewing our criteria for testing because we want to find as many people as possible. And this is public health at its finest. The earlier we find cases, the sooner we can contain the spread by isolating those persons who are diagnosed with COVID-19. I can't, however, say that the 33 represents all of the persons with COVID. I cannot even tell you if it represents just a small proportion of the persons with COVID-19. But we are looking for it aggressively. We want people to come forward who have respiratory symptoms by calling us at the hotline, by calling their healthcare provider. Healthcare providers consult with us at the Ministry of Health, and we made a determination if this person should be tested for COVID-19.
Corey, if I can weigh in on this matter, you'll know that the first trigger to get to phase 3, I think, one of the triggers is more than 25. At the time when the Prime Minister sought Cabinet's approval to take these measures, we were at 24. So there's no doubt that we had not yet passed that numerical threshold. But it was a judgment call that we had to make. And that judgment call revolved around a question of, is there any advantage to waiting for another 2 or 3 days or 4 days or 5 days till we check all of those stage 3 boxes? Or is it more strategically important for Barbados to get ahead of this disease, in which case we take strict measures but at an earlier stage than perhaps other countries might have? This is not the kind of exercise that you can carry out with a foot ruler or measuring stick, or on a strictly numerical basis. Those numbers are for guidance, and we are happy to have them. But for us, it became a judgment call, and that judgment revolved around whether we take steps earlier or do we wait until we can check all of the stage 3 boxes. And I think we made the right decision. As far as the question on bakeries, I'm sorry?
Go ahead to the question
on
bakeries. I just have one follow-up on that other matter. Go ahead.
As far as the question on bakeries go, we recognize that bakeries have to start earlier, and therefore we have allowed bakeries as a standard to operate from 6 a.m. to 6 p.m. We hope that people will honor the spirit of what we're trying to do and try their best to work within our time, within the time that we've stipulated. One of Barbados's largest producers of food, as difficult as it will be for them, they're accustomed to having a 24/7 operation, and they have said, in these circumstances, I'm going to function within the 8 to 5 timeline that you've given. It's going to cost us money, but the interests of the country are paramount.
In order to start at 6, they're saying their drivers need to be on the road by 4 to collect the workers. So
well, let's make this clear. When we say that a bakery is allowed to operate between 6 to 6, we're not telling a bakery that they must start at 6. They can say we're going to tighten our time and start at 7 or 8. What we're saying is we're giving you a beginning point and we're giving you an end point. But to come to the point, we recognize that in situations, if we give you a 6 o'clock start time, I would hope that the bakery would say, okay, we can't, my employees can't get there on time, so we're going to start at 8. Maybe we will not produce all of the variety of bread that we would normally produce in normal times. Maybe we'll just stick to salt bread, sandwich loaf, and current slices. They're decisions that we all have to make, and we want people to work with us. In a situation where there's no helping it, and the bakery absolutely must start at 6, then they can ask for an exemption to permit certain people to be on the road earlier. But in cases where I'm giving exemptions, in every instance, we are asking those businesses, how can you scale back? If you're going to get the benefit of an exemption, you're going to have to scale back. So some manufacturing companies have got exemptions, but on the basis that they move their staff complement from as much as 50 down to 10. Others, they've been asked to move their staff complement from, some have agreed to move it from 30, and they say we will run our shift on 9. So it's not just about asking for an earlier time. If possible, you can get it. If not possible, we want you to work within the time frames given. But if you are going to get the benefit of some exemption, we expect you to show better faith and cut back on the number of people that you have in your plan.
Okay, David, you had a follow-up?
And yes,
I wanted
there's
to
a
come back
system
to
of
this
passes.
question.
Sorry?
You were saying something about the system of passes?
I'm saying that there's a system of passes that we've developed with the Ministry of Innovation, Science and Technology. We have been able to develop a system which uses what are called QR codes. Let the techie people explain what that is, but essentially a pass, if you're granted an exemption, a pass will be sent to your mobile phone, or it will be emailed to your employer so they can print it out and give it to you. It is read by a QR code reader, and all of the police who are going to be on patrol are being provided with these readers so that the police officer, without having to take anything from you, because we still want to minimize touching and so on, they will be able to hold their phone over the code. The data will get sent back to the master computer or whatever it is, and that will verify, yes, this is a legitimate pass issued to John Brown. And with that, they go on the way.
That sounds good. Now, the question of the figures, the trend. When you look at the trend here in Barbados, what is your worry? Because there are days when we will not hear that there has been any increase, like yesterday. But when next we hear, the numbers seem to jump significantly by our standards. There are people who are listening to this and may be worried about the trend. What are your thoughts on it?
So the number that I gave was different from what was released yesterday. We are at 33. We increased by 3. No, sorry, we increased by 4. We had 3 yesterday, and we had 4 the day before. So on average, we're detecting about 3 or 4 new cases a day. We had one day in which we detected 8 persons. One day we detected 1. And then I think it was one day when we detected 0 cases. And this is all over a 12-day period. Because our first case was detected on the 16th, late in the night on the 16th of March, and today is only the 29th. It's very difficult to make an informed assessment about the trend. I would love to be able to say that we are identifying all the cases of COVID-19 in Barbados, but I can't say that. We are only detecting the cases that are presenting to us. So I know it doesn't leave a great level of comfort, but this is what we're struggling with within the Ministry of Health. We're trying to sensitize not only the general public to come forward and call somebody if you have any respiratory symptoms, but we're also asking our colleagues in the private sector to be highly suspicious of COVID-19, know what it looks like, know how it's diagnosed. We want persons to call their regular healthcare provider if they have symptoms so we can start to detect cases. The other thing that we do to detect cases is contact tracing, which is extremely important if we're going to contain this virus.
No chance of ramping up testing?
Okay, I'll get to that shortly. So contact tracing would involve us taking the index case that is before us and getting a detailed history of everything that they did over the last few days, who they came into close contact with, developing a list of all of those persons that they live with and persons they came into close contact with, and then the team goes to those persons and asks questions, confirm that they came into contact with that person, what was the nature of that contact, and how are you feeling. Those persons then go into quarantine if they're asymptomatic. However, if they're symptomatic, we then have a high level of suspicion of COVID-19, and we would test them for COVID-19 as well. You asked a great question. A lot of people are asking about if we're going to ramp up testing. We have ramped up testing. We're now testing in excess of 20 tests a day. We know we need to do more. We are looking to identify an additional center. We do need other doctors out there to either be trained in how to do the nasopharyngeal swab, or if they know how to do it and they've been fitted for the N95 mask, which is a very important aspect of PPE, personal protective equipment, to come forward so we can add them to the roster so we can swab as many people as possible. One of the lessons that we're learning from other countries is test. We have to find you have to put strategies in place to identify as many cases as possible. The earlier you identify a case, the sooner you can render that person not capable of passing on the coronavirus, because you can isolate them. So that's a key strategy that we are in the process of implementing. We do have, at this current point in time, a few thousand test kits, or tests rather. We are looking to scale that up dramatically to 50,000 in the first instance, and then 100,000. And we're also looking to utilize other technologies that would help us in terms of diagnostic testing.
And who would be eligible for testing apart from those who show symptoms?
So right now we're focusing on those persons who show symptoms. We have done some testing on persons who are asymptomatic because we had reason to believe that the contact with the index case was of such a nature that this person could possibly have it but not showing symptoms. But we haven't detected a case of COVID-19 in somebody who's asymptomatic as yet.
Okay, thank you very much, Corey. Thank you all.
Yeah, so we do have a specific set of criteria in mind. And let me stress that the criteria that we had 2 weeks ago, 1 week ago, has changed from what we do now. We have to be responsive. We have to be dynamic. We have to pay close attention to what we're seeing happening. And if we need to change the testing criteria for whatever reason, we would do it.
All right, thank you. 12 minutes after noon. This is Brass Tacks Sunday with the kind compliments of Williams Industries. News at 12:30. Those on the line, I'll ask you to speak to the producer when we break, because you could either hold or you could get the producer to call you back. Let's get some more calls in and get some more questions answered. Brass Tacks Sunday, good afternoon. You're on the air.
Good afternoon.
Hi, good afternoon.
Hi, good afternoon to the panel. I'm calling on behalf of the funeral sector. We have been given exemptions for funerals, but I'm calling to find out about our workers, because we, as funeral directors, we employ a large part of the repair sector because we store bodies and our fridges, in case they break, and we want to know if we can call out our technicians. And we also want to know about caskets in terms of the oversized casket. Sometimes we have bodies that do not fit the standard casket we have in storage, and we rely on our builders to build oversized for us. And the body harbor is closed, we do not have the materials to build the oversized caskets. So what would you all recommend for the funeral sector in terms of storage? Can we call out our technicians if our fridges fail? And in terms of the oversized body where the casket has to be built when there's none in stock, what do we do there? Do we encourage the family to hold on until the time has passed? Or do we... what do we do? Because we need to know what do we do in the funeral sector, although we have been given a pass in terms of bodies and storage and burials of persons that are not the standard size for caskets that are readily available. We would like to know what we would have to do. And in terms of viewings, we have seen that funerals have been down to 10 mourners plus the staff, but we still have viewings. Would you recommend that we have no viewings at all, or do you recommend that we do a pass-through where persons are allowed maybe a minute or so in the viewing of the chapel? I would listen for your reply. Thank you very much, panel.
Thank you.
If I can go first, I'll let Anton talk about the pass-through and things of that sort, because he'd be best able to talk about the risk. One of the exemptions is the removal, handling, or burial of deceased person. Now, this is a very sensitive issue. Let me say that if a funeral home must operate, if you have your own personnel, then there's no objection at all to those personnel coming to fix your technicians to come and repair your freezer. On the other hand, if you need to get somebody from outside to do it, that person will have to get an exemption. Now, let me make it clear. Now, we don't anticipate that your freezers will break down every day. And our position is that where an enterprise is a vital component to an essential sector, that we will at some point in time have to grant exemptions. So you speak about your freezers, somebody else may speak about the supermarket freezers. The concept is the same, and therefore we will grant exemptions in cases of emergency. So, that I don't think you need to despair. And in a situation where that happens, the technician who is called out can communicate with us and get an exemption.
Mm-hmm. The second part about the viewing as well, if when Anton you respond, you could add to that.
Sure. So we were approached about 3 weeks ago by, I believe it's the Barbados Association of Funeral Directors, as to what special considerations need to be on the table when you're dealing with persons who've died from COVID-19. The response that we gave was some direction from PAHO. So PAHO put out, this is the Pan American Health Organization, they put out some guidance on the 18th of March. And in essence, what they're saying is that there's still some uncertainty about what we in healthcare call the natural history of COVID-19 in terms of its ability to be aerosolized. We acknowledge that, but in terms of having a definitive understanding of how long it lasts, for instance, we're still uncertain. So they recommended standard precautions plus the use of personal protective equipment. So right now, they're suggesting that you be just extra cautious when it comes to the management of the dead person, and this is advice to death care workers. With regards to the viewing of the body, we have to be cognizant that the cultural consideration, but we also have to be cognizant that this person is dying from an infectious disease, of which we know a lot, but we don't know everything. So if I may, in my personal view, I would recommend after the body has been prepared by the funeral home, that there be no open casket viewing. But this is a conversation that is evolving based on the evidence. And as I said, PAHO only just put out guidelines 2 weeks ago, and they will be updating the guidelines as more data comes in as to how best to manage bodies.
Okay, I think that's sufficient. Brastat Sunday, good morning, you're on the air. Let's take the next call. Hello? You're on the air? Okay. Brastat Sunday, good morning and good afternoon and welcome. Good afternoon and welcome. Okay. Good afternoon and welcome, you're on the air. Hello? Brastat Sunday, good afternoon.
Yes, good afternoon.
Yes, please, go ahead.
Yes, I would like to know if government day nurseries are a necessity, one of the services that are included that you definitely have to go to work.
Let me say that private day nurseries fall within the definition of businesses, and therefore it is expected that they would be closed. We're trying to treat all businesses on the same basis. And the government day nursery, I'm waiting for a further set of dialogue with the Ministry of People Empowerment and Elder Affairs. But I think that we will be going in the direction of having government day nurseries close. We anticipate that it would not create as much hardship as in normal circumstances, because with most businesses in Barbados being closed, the requirement really to have the children in the nursery would be less. But the fact is that always operating on the basis that we want to follow the overriding objective of minimizing human contact. I don't think that that we would want to allow government day nurseries to be open while private day nurseries are closed. And I can say that I have received no requests from any private day nursery for an exemption.
All right, thank you. Brastat Sunday, good afternoon. You're on the air.
Hello.
Hi, good afternoon.
Yeah, by touching money can help spread virus, and also if you in a room that have AC, that could also help spread it also.
Dr. Bess?
So,
Dr. Bess?
yeah, if I may, so touching anything that has been touched by a person who has COVID does increase the likelihood of the person who's negative contracting it. And that is why there's a tremendous amount of emphasis on hand hygiene. So you should be washing your hands frequently with soap and water. You should be using alcohol-based hand sanitizers. You should also practice other aspects of hygiene, such as not touching your face. That is how we get COVID. We touch dirty surfaces. We then take our hands unknowingly, unwittingly, and touch our mouth or nose or eyes. And that's how the microbe is able to get in and start its damage once it gets into our system. So theoretically, touching money is a way in which it can be passed. So the standard precautions, as I just mentioned, are what I'm recommending. In terms of the use of AC, what is recommended for persons who, especially for persons who are in home quarantine or home isolation, is that you should be in places that are well ventilated. And well ventilated in our context means open windows, open doors. You are going to reduce the likelihood of circulating pathogens, and you're going to get a high throughput of air, greater volume to disperse any pathogens that might be coming off of a person who has COVID.
All right, thank you, sir. We're trying to take as many calls between now and the latest, and then I'll get to the WhatsApps. During the news, I'll try to put all the similar ones together and put them into a few questions. So let's go again. Brass Stats, good afternoon. You're on the air.
You.
Hi.
Hi.
Good afternoon.
Good afternoon.
Yeah.
Go ahead with your question, ma'am.
Yeah, I have three questions. I would like to wish the Prime Minister well, right? And I have three questions for you. In relation to international trade law, what provisions will be made? In the future for some event like this happening again?
Well, let me say that I'm not an international trade law specialist, but I don't know specifically what kind of events you're thinking of. Global pandemics are things that happen, or as you can see very quickly. We've had H1N1, we've had Czars, we've had many other pandemics before. On this occasion, it's COVID. It has been spreading very quickly. I think Anton since December last year. So I don't know that there's a specific international trade law issue that would arise. I think that there are trade law issues that arise because obviously there are companies that are not going to be able to fulfill their contracts. So a supplier in China may not be able to supply his market in the U.S. simply because air traffic and shipping is down. So this has thrown up an awful lot of legal discussion, but I don't know that there's a specific international trade law issue that we can reach an agreement over because of COVID.
All right, ma'am.
What I can say, AG, if I may, is that we have something called international health regulations, which is, as I understand it, legally binding international law, 2007, that all countries have signed on to. So even though it's not trade, it takes trade into consideration. And essentially, the spirit of that law is that all countries have a duty to prevent and control the spread of communicable diseases. So you're looking to control the spread of communicable diseases within your country and in other countries as well. So it takes border security into consideration. And what I can say is that all of the decisions that we have made in Barbados have taken international health regulations into consideration in order to reduce the spread of COVID-19 as well as other diseases.
Okay, good. Thank you. Brass Tack Sunday, we are heading towards the latest, so I'll just use this time to pull out a few quick WhatsApps that came in. There's someone asking about feed. I have 2 containers of feed. They're perishable, and this is to support farming. Will these containers be able to be cleared?
There are 2 things here. First of all, feed companies are going, feed manufacturers, feed distributors are going to be vital to the farming sector continuing. We've made a special exemption for farms, and we're even allowing farms to operate from as early as 5 in the morning, whether that's livestock or vegetables or whatever it is. It is inconceivable that we could ask for farming to continue. It's inconceivable that we could ask Barbados and Barbadians to move towards self-sufficiency in agriculture just in case this COVID continues to get worse, while at the same time not giving exemptions to feed producers and feed distributors. I have received some requests for exemption, and it is proposed that I would grant those exemptions. Now, in relation to clearing of things out of the port, which is really the second part of that question, again, our focus is on those things that support our vital interests at this point in time. Medication, food. So if a person has containers to be cleared, and those containers are of animal feed, then the entities that would participate in that process, customs brokers, truckers, whatever it is, would be able to receive the exemption limited to that purpose so long as they request.
Okay, sounds reasonable. You're listening to Brass Tack Sunday. We are on the air with Attorney General Dale Marshall, COVID Czar Richard Carter, and Chief Medical Officer Anton Best. I'm your host, and this is brought to you with the kind compliments of Williams Industries Incorporated.